Impact of DLD on mental health and well-being across the lifespan, and engage with DLD Research Summary. Click the microphone icon on each slide to hear an audio recording of the research summary. Key terms, words to know in this research. Mental health, emotional, psychological and social well-being. Masking, hiding behaviours associated with neurodiversity to fit in with peers. Discrimination, being treated unfairly because of a difference, for example in race, gender or disability. Study background. Why was this study important? People with DLD often face academic, emotional and behavioural difficulties. These difficulties can be present from childhood to adulthood. It's important to hear about these experiences directly from people with DLD. This way, researchers and therapists can better understand their struggles. Study aims. What were they trying to find out? This paper aimed to look at the experiences of people with DLD throughout their life. It looked at factors which might affect the mental health of people with DLD. Methods. Participants. Who took part in the research? 6 adults from England with DLD took part. 5 speech and language therapists from Western Australia also took part in the research. Methods. Tasks. What tasks were involved in the research? Speech and language therapists attended a workshop where they shared their views. Participants with DLD shared their views in a number of different ways. Some participants wrote their answers down. Others attended an online workshop where they talked about their experiences. The researchers then derived themes from the group discussions to understand the participants' perspectives. Results. What was found? Theme 1. Perspectives on diagnosis and living with an invisible disability. Participants discussed the lack of awareness of DLD. For example, some found it difficult to get a DLD diagnosis. Getting a DLD diagnosis helped some participants, making it easier to advocate for themselves or share their needs. Theme 2. School struggles and self-esteem from past to present. Adults with DLD may suffer from mental health conditions like anxiety and depression, and experience difficulties both at school and at work. Theme 3. DLD across the lifespan. Participants shared the continuing difficulties and efforts required to mask their differences in everyday life and at work. This affected their mental health. Theme 4. A sense of belonging, communication, connection and support. Adults with DLD may also suffer from loneliness because of difficulty with social situations. They also reported bullying and discrimination. What do the findings mean? People with DLD face both language difficulties and experience mental health concerns because of their disorder. Access to diagnosis is important for people with DLD to ensure appropriate accommodation at school and at work. more public awareness of DLD as a lifelong condition may also help people feel more supported. Future research should aim to better understand how to support people with DLD across their lives. Find out more. You can read this whole paper for free by following this link. Thank you for reading this research. Contact us with questions or feedback at Engage with Developmental Language Disorder.